After multiple delays, the Philippines has begun its COVID-19 vaccination campaign. But a supply crunch could slow things down. Buena Barnell with more.
Among the first medical workers in the Philippines to be jabbed with the COVID-19 vaccine come from here, at the Armed Forces of the Philippines or AFP Medical Center in Metro Manila. The AFP National Health Service Command says these hospital personnel caters to a daily average of 50 COVID-19 patients, including members of the force and their dependents.
The Philippines officially started its COVID-19 vaccine rollout using Sinovac biotech vaccines donated by the Chinese government. This is the latest diplomatic gesture from the neighboring superpower. But we also see military diplomacy at work.
100,000 of the 600,000 vaccines that arrived on Sunday, a day before the rollout, were allocated for the Philippines Armed Forces, donated to them by the Chinese military.
Hindi siguro sapat yung 100,000 dahil dito pa lang sa DND proper sa kayong mga bureaus nila, except AFP eh 30,000 na eh. So ang matitira na lang is 70,000, ibibigay ko kay General Sobihana. Bahala na rin siya mag-determine kung sino yung babakunahan.
The Philippines is among the last countries in Southeast Asia to start its COVID-19 vaccine rollout, lagging behind Thailand for just one day. Despite strong rebuke from government critics highlighting that the initial rollout relied on donations, the country's health minister says neither were there lapses in vaccine deal negotiations nor were the procurement efforts slow.
All the way best effort. No? Wala tayong nakaligtaan, lahat ng dapat gawin, lahat po ng ating mga dokumento ay talagang pinaghandaan, pinirmahan at kayo mismo ang nakasaksi na hanggang ang ating Kongreso ay talagang sumuporta.
Priority segments of the Philippines COVID-19 vaccine rollout includes healthcare workers, vulnerable elderly and indigent citizens, uniformed personnel, and other essential workers. Public perception towards vaccines in the Philippines was severely impacted by a dengue vaccination program that ended with the vaccine called Dengvaxia being recalled in the country. The recall was due to incomplete papers, but vaccine hesitancy was seen when deaths were unduly linked to Dengvaxia.
For the Armed Forces of the Philippines Health Service Command, vaccine recipients need to undergo a clearing process that includes a temperature check, a counseling session with a video about the vaccination stream, and the signing of a consent form, among others. This donation from China signals the warming ties between Manila and Beijing under President Rodrigo Duterte, with the president even saying that he will go to China before the end of the year to personally thank his counterpart, Chinese President Xi Jinping. Buena Bernal, CNA, Manila.